A catastrophic injury can happen to anyone, anywhere, at any time. Each year in the United States, 1.7 million people sustain traumatic brain injuries, and more than 12,000 sustain spinal cord injuries.
When your life is changed in an instant, the most important thing is surviving. And once you survive a catastrophic injury to the brain or the spinal cord, or even both, it's important that the next phase of care have the expertise to meet your very specific needs.
For decades, Craig has been a national center for patients with spinal cord injury and brain injury to come and avail themselves of the vast resources and expertise that Craig has in these areas.
Each year, hundreds of people come from nearly all 50 states to Craig Hospital, a specialty rehabilitation center in Inglewood, Colorado, a suburb of Denver.
And by specializing in only 2 diagnoses, it allows us to ensure that our staff practice with the level of education and expertise that they need to make sure that when patients come to us, they leave with the skills necessary to gain independence.
Craig is a 93-bed hospital that exclusively treats people with spinal cord and brain injury. In 2011, Craig broke ground on a transformational project, adding 85,000 square feet of new space and renovating nearly 135,000 square feet of existing space to better accommodate our patients and programs.
You will be able to come to one location and have the needs of that patient met through many different disciplines that we have available here at Craig. Medical care, nursing, physical therapy, occupational therapy, therapeutic rec, discharge planning and social work, and many other types of team members that surround this patient to help them be successful with gaining as much independence as possible after this disability. To have many opportunities outside the walls of our facility that help them gain independence and encouragement that they can move on with their lives from this disability. That's what makes Craig unique. They don't have to leave us to go to another facility to prepare them for home. We do that here.
The most prominent space on the first floor addition is the Peak Center. The 2-story gym is open 6 days a week and is used by Craig inpatients, outpatients, and individuals from the community with neurological disabilities. The space features leading-edge rehabilitation equipment and 2 aquatic therapy pools. Our new inpatient rooms feature accessible bathrooms and state-of-the-art integrated control systems.
We have taken the opportunity to put some technology in that room that gives patients a sense of control. They can control the lighting in the room, having the window blinds go up and down. They can control their TV, as well as the temperature in the room. And we've really just begun in using smart technology here at Craig.
This technology is life-changing. It gives the patients more independence, really contributes to Craig Hospital's mission, gives them very small aspects of their life back, which mean a great deal to somebody who's just had a catastrophic injury.
The new rooms feature a retractable patient lift system easily hidden when not in use, providing seamless patient transfers from the bed to bathroom to wheelchair. Large therapy gyms on both the 3rd and 4th floors give physical and occupational therapists dedicated space to work with patients on a variety of rehabilitation goals. A transfer training room teaches patients the skills necessary to move from a wheelchair into cars, beds, or airline seats. The Upper Extremity Lab contains specialty rehabilitation equipment to help patients regain arm movement and grip function by exercising and strengthening shoulder, elbow, and hand muscles.
The value of Craig Hospital is immense, and it has to do with the experience and expertise of our physicians, our staff, the resources that we have in terms of technology and programs for people with spinal cord injury and brain injury, the commitment we make to families and family education, the therapeutic recreation services, and about 3 dozen other subspecialty programs at Craig that are just not found in other rehabilitation units.
After a spinal cord or brain injury, a person's life has been altered forever. Many patients and family want to stay close to home, but their best option may be hundreds, if not thousands of miles away, here at Craig.
We as a facility are made aware of a patient in another facility potentially needing our expertise level of care. We will send a liaison out to that hospital to meet with the patient and family, as well as their medical team, to explain what we do at Craig, to explain our history and level of expertise of our staff, to explain costs and all the resources that we have available here for patients to help them make an informed decision about choosing to come to this facility or not. Once that decision's been made, our admission department works very closely with the patient and family to ensure that adequate transportation is available.
At Craig Hospital, families are an important part of the rehabilitation process.
So for decades, Craig has had a commitment to family inclusion. Not just family involvement, but family inclusion in all aspects of the treatment program. And inclusion also includes family housing. So right on campus, we have a family housing building where families of our newly injured patients can stay and be right on campus to be part of the entire rehab process. And that is subsidized, so up to 30 days is at no charge to the families. And we feel very proud that we're able to bring families from around the country to be part of the rehabilitation process.
Each day at Craig Hospital, you will find patients with like injuries hard at work.
The day in the life of a patient at Craig is very busy. Depending on when the patient's therapy starts in the morning, we have occupational therapy assistants who can start the patient day as early as 6 a.m., working on daily living type of activities, and then personal care that will occur in the morning. Or patients can start their day on any hour, on the hour after that as well. Breakfast is in the morning. We expect that our patients, if they don't have a medical limitation, that they're going to get up and go into our bistros, which is what we've named our dining room spaces here at Craig, to be in a community when they have all of their meals. And then they have a full day of different therapies, physical therapy and occupational therapy for sure, as well as what other therapies enhance their experience here at Craig and are medically ordered by the physician. Depending on skin tolerance or medical clearance, these patients can have anywhere from 3 to 6+ hours of therapy a day. We also have a very active therapeutic rec department, which for us is really just an extension of their therapy throughout the day. And so now they're able to use those skills as they participate in fun activities, whether it's outings outside of the building or just hanging out in the rec room with other patients and families.
There are many different components that make Craig a specialty center for rehabilitation, including our nursing care and interdisciplinary team approach.
The nursing care at Craig is unique. We have nurses that are highly trained in the care of someone with a spinal cord injury or a traumatic brain injury. Those outcomes are measured by the successes and recognition that the department has received nationally. We are a third-time designated magnet facility. We have also received the highest quality award through Press Ganey for the last 5 out of the 6 years for the highest quality outcomes in nursing care in a rehabilitation facility. The majority of our nurses are BSN trained, as well as over 80% of our nursing staff are ACLS certified. And so we have a very highly qualified, caring and compassionate staff to care for the patients.
But typically what it entails is a primary manager or primary physician working closely with a family service manager, and together in combination there's many professionals that work together. You and your loved ones make up the interdisciplinary team. We also have rehabilitation restorative nurses 24/7 carrying out care and carrying out follow-through of the rehabilitation treatment plan. You might have speech therapists, physical therapists, occupational therapists, recreational therapists, respiratory therapists, nutritionists, a pharmacist, a psychologist, or even a neuropsychologist would be part of this team. As you can imagine, these are a lot of individuals with their expertise in one area, but the reason it's called a team is because there's leadership within the team and you know who does what, and there's constant reinforcement with that, as well as meetings and planning sessions with you and your family, as well as dealing with the outside agencies and outside community resources that need to become part of the team as we deal with reintegration.
Rehab is hard work. Rehabilitation for someone who has a catastrophic injury is not just physical rehabilitation, it's also emotionally, spiritually, mentally rehab, and so it is hard. In addition to that, it's really important that we provide them with the level of support that they need to grieve through this disability. And they do need to grieve through it And so we have a psychologist as well as counselors or neuropsychologists available on staff to meet with the patients and or the families.
Craig is a special place where peer support plays an important role in recovery.
The only person that can really understand what you or your loved one is going through is someone else who is doing it the same. They're experiencing it the same way. The issues that you or your loved ones dealt with in the acute care hospital and the issues and challenges that you're going through in rehabilitation. The concept of uncertainty. The idea that you can be around many, I'm talking dozens of people with similar injuries and families that have been through this before, and that you can help each other, learn from one another's experiences, it goes a very long way. It's not just what the physicians or the rehabilitation experts can do, but it's how others and how a whole community can come together to help you build the resilience necessary to not just get through this, but to rebuild your life after.
With an individualized focus on the patient and family, Craig aims for optimum independence.
Well, one of the reasons that insurance carriers and other hospitals and consumers from around the country choose Craig is because of the extraordinary outcomes that we're able to achieve. We collect a lot of data about a lot of things at Craig, but at the end of the day, there's 4 or 5 major outcomes that are important to us and important to the folks that we serve. One is returning patients home, getting people back home and not having to go to another institution or a nursing home. Independence, levels of functional self-sufficiency and independence so that people don't have to have as much attendant care or home health care. Number 3, return to work and school, being productive again and paying back into society and having that sense of contributing to society. And then people's self-worth and their life satisfaction despite they've had serious injuries. And lastly, I'd say is rehospitalizations, helping people to be medically safe and medically stable after they've left Craig, so they don't have to return to the hospitals. Those are some of the key outcomes that we do very, very well at.
You're going to get quality care. You're going to get responsible, dedicated professionals that have the same goals as you, as a referring clinician. That is to follow through on the care plan that you've started and to be sure that unanticipated issues are dealt with properly, and then when anticipated issues come up, they're dealt with responsibly in a very caring, loving, and a holistic way.
Learn more about Craig Hospital and how to refer a patient at craighospital.org/admissions.